set of medications that are generally called statins, and the statins actually block the assembly line that makes the cholesterol molecule in your liver. So you can eat less cholesterol, and in addition, you can block the synthesis of cholesterol in your own body. And by these two techniques, you can reduce the total amount of cholesterol that's available for your body to put into your artery wall. Now, there's another important piece of this that we haven't discussed yet and that I want to bring up now, and that is that atherosclerosis, or the buildup of cholesterol in your artery wall, is not a passive process. It's not like the sand that gets deposited on your street in the gutters when it rains. It's not just a gradual buildup of a passive material. It actually causes inflammation in the artery wall. That is, as the cholesterol builds up, the artery wall can get inflamed. And in fact, it's the rupture of one of these inflamed plaques that act like a little boil basically within the artery that causes a sudden event. The sudden death of Tim Russert, for instance, which many of you will have heard about, was essentially caused by a plaque rupture. It was well known that he had the illness, but despite everyone's best effort, one of these plaques ruptured, blocked off his artery very suddenly, and of course his heart was unable to function right. So it's important to understand that that atherosclerosis is not just a passive buildup of cholesterol in the artery wall. It is that, but it's also the inflammation that's associated with that buildup. And happily, the statins not only prevent cholesterol from building up in your system, but the statins also have an anti-inflammatory effect. That is, they block this inflammation. They stabilize, so-called, the plaque so that it's less likely to rupture and cause you to have an acute heart attack. Those two effects of the statins, to reduce your total cholesterol and to reduce inflammation, are the main reason why the statin set of drugs, these are such drugs as Lipitor, Crestor, and many others, Zocor, are so important in treating patients who have abnormal lipid profiles or who already are known to have coronary artery disease. Besides these important chemical features that we've been discussing, there are some other things that are very important in order to stay away from me. One of them is high blood pressure. High blood pressure hammers the wall of your arteries and, of course, increases the stress on the wall of the artery and allows the damage to occur more easily. So blood pressure control is essential to avoid atherosclerosis, and it's also essential to avoid other serious health problems. So one of the most important things you can do is get your blood pressure measured every once in a while and make sure that it's under 140 over 80 at most. The next thing is, and it's almost beyond stupid to have to mention this in this day and age, but tobacco smoke is poison. If you smoke, in essence, you're attempting to commit suicide because you'll either die of lung cancer or the inflammation that the smoking causes within your blood makes the inflammation of the atherosclerosis worse. It provokes plaque rupture. So, needless to say, don't smoke. Another irritating feature to the artery wall is high blood glucose levels. So diabetics in general are more susceptible to coronary disease because the high glucose level, when it persists, helps damage the arterial wall and allows the cholesterol molecules to get in there and cause trouble. So maintaining good, reasonable glucose levels is very important. Now, there's two other really important things to mention here. One is, how does obesity affect this? There's so much on television about, getting a wonderful-looking body and being fit and blah, blah, blah. But there are some important medical things, and I'm just going to touch on one of the most basic, and that is that in people over the age of 60, we have good scientific data that if you're very obese, you have a much higher chance of mortality from all causes. Now, one of the ways doctors study this is by measuring what's called body mass index. It's hard to compare sizes of people because a man who's 6'4" and 240 who plays in the NFL is certainly not, 240 may be a lot of weight, but it's not much if you're 6'4" and you're in terrific shape. Whereas a person who's 5'1" and 240 pounds is almost certainly massively obese. So the way physicians get around this and scientists is to take the weight and divide it by the height squared, and this is body mass index. And it just gives us a way of comparing people of all sizes. And body mass index of greater than 25 is obese, and greater than 30 is quite obese. So let's look at a study that was done at the Cooper Clinic in Dallas, Texas, which is a very important study for all people over the age of 60 to know about. It's one of the really good scientific studies that is approachable, that you can understand if you're a normal citizen and you just want to understand how to be healthy. In this study, physicians at the Cooper Clinic measured the body mass index of almost 3,000 people and then followed them for 12 years. They also did some other things that I'll mention in a moment. But they followed the body mass index and they followed the longevity of these 3,000 patients who were over the age of 60. And what they found is shown up here on the slide that you're looking at now. And that is, if you had a normal body mass index or a slightly obese body mass index or even a moderately obese body mass index, it didn't have that much effect on your survival. But if you look at the box all the way to the right, you can see that when you're morbidly obese, when you're quite obese, it more than doubles your risk of dying. So that as they followed these 3,000 people over 12 years, more than twice as many of the very obese people died during that period of time as the people who were of normal weight or close to normal weight. So while there's no need for you to try to win the Miss or Mr. America contest, there is a reason not to be really fat. Now, this same study also followed the fitness of these people. That is, all of these 3,000 folks were put on a treadmill test where the doctor made them walk up the treadmill more and more vigorously until they couldn't go anymore. And if you haven't had this test, it's something to think about, because fitness turns out to be the single most important predictor of survival for people over the age of 60. And at first, that may sound crazy, but what I just said was that the machines who are in the best condition last the longest. And the way to find out whether your machine is in good condition or not is to walk it up a treadmill vigorously. And remember, they weren't just measuring death from coronary disease or from heart disease. They were measuring death from all causes. So as they followed these 3,000 patients over 12 years, the patients who survived the longest, who had the highest survival, were the people who were the most fit. This slide shows that very clearly. The least fit bunch of people had more than 4 times the mortality of the most fit group. The group to the right there, the people who were in the top 20% of performers when they were put on a treadmill, and the people that are all the way at the beginning there, the group with the highest box of deaths, the people who were the least fit. And so it's quite clear that fitness is extremely important to avoiding dying of all causes, and since the commonest cause of death in our society is cardiovascular disease, it's obvious that fitness is very important. So if you want to avoid having to come to see me or one of my colleagues, or if you've already seen one of us and it wasn't as much fun as you thought it was going to be and you'd like to not have to come again, at least for an operation, the first joking thing is pick the right parents, or if you can't, try to eat a low-fat diet, a so-called Mediterranean diet, and take a statin if your doctor recommends it. Maintain a normal blood pressure. Maintain a normal blood glucose level. Don't smoke. Don't be very fat. And most important of all, work on your fitness. Now, if you have any questions about this, or if you want to learn more, you can go to the website that's up on the screen now, or type my name into YouTube, and there's some other videos about heart disease that may be interesting to you, particularly if you need an operation. And I thank you for your attention.